Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. Here are some of the highlights this hour. Meeting between federal government and labour unions end in deadlock as Labour disagrees with government over decision on increase in prices of petrol and electricity tariff. Kogi State government give details of school reopening, insists on safety of school children and adherence to the COVID-19 protocols. And in France, foreign nationals who have worked on the front line of the coronavirus pandemic to be fast-tracked for citizenship. We begin in Africa, where total cases of COVID-19 is over 1.3 million cases. The death toll continues to climb, and so has the number of those that have recovered. In South Africa, which has the largest confirmed cases on the continent, about 12 million people, 20% of the country's population, may have been infected with the coronavirus, a much higher figure than the official cumulative number of detected COVID-19 cases, which is 650,749. Now, according to South Africa's health minister, the new figure emerged from a research that was carried out by examining the amount of antibodies present in a patient's bloodstream. This is as over 2,000 undertakers have gone on strike in South Africa, demanding better pay and working conditions. In the meantime, Nigeria, a multi-sectoral National Emergency Operations Center, EOC, is still at level 3 as it continues to coordinate the national response activities. The NCDC says it is supporting the sensitization of civil defenders personnel to be deployed for coming elections in Edo and Ondo states on COVID-19 safety measures. The country confirmed 132 new cases reported from 11 states, with Lagos the highest there at 52, Rivers and Osun State recording 1 cases each. Till date, Nigeria has a total of 56,388 with 44,337 cases discharged, and our death toll stands at 1,083. Members of the Organized Labour Movement, the Nigeria Labour Congress NLC, the Trade Union Congress TUC have disagreed with the federal government over the recent hike in electricity tariff and the cost of petrol. Speaking at a dialogue session with the Labour leaders in Abuja, both the Minister of Safer Petroleum and the Minister of Power maintain that the situation is inevitable as the government can no longer sustain subsidy payment for petrol and electricity. Meanwhile, the leadership of the NLC and TUC insists that the federal government is unjustly transferring the cost of long-term inefficiency of governance to the poor masses, calling for the immediate reversal of the recent price hike. The labour unions are threatening to down tools over the rise in tariffs. They are also asking of the implementation of the 30,000 naira new minimum wage, complaining of alleged corruption in government agencies and other issues in light of the impact of the coronavirus pandemic. Now, members of the Nigerian Medical Association employed by the Ogun State government have threatened to go on strike if what they termed appropriate salaries due them are not paid by the state government. At a press briefing held at the Olabisi Onabanjo Teaching Hospital, Shagamu, members of the association announced that the 20th of this month for the commencement of the industrial action if their demands are not met by the state government. While describing their demands as legitimate, the chairman of the association, however, debunked insinuation that the proposed action may be politically motivated.
Apart from the doctors in Shagamu, at the teaching hospital, all other doctors in Ogun State in the employment of Ogun State government are also agitating for the same appropriate remuneration of doctor's salary. Affiliate like NAGMDP and the doctors in the local government. So all the doctors in Ogun State are actually agitating for this same problem. And we are doing this so that we want to inform the general public that the strike has been suspended since 7th September 2020, and we are waiting for government to start meaningful discussion on this problem. It is also to tell you that if the government does not resolve this issue by the 20th September 2020, resident doctors in Shagamu and their senior counterpart, the MDCAN, will resume this industrial action.
Staying with industrial actions, the Taraba State chapter of the Joint Health Sector Union, they've joined the nationwide strike declared by its national body to press home their demands. According to the union, the warning strike only involves health workers in federal medical centers and federal teaching hospitals across the country. The acting chairman of the union says if the strike yields no dividend, other health institutions will join in. It insists that government must do the needful to meet the needs of the frontliners in the health sector. And it's been a long stay at home for students and teachers in Kogi State due to the coronavirus pandemic. But since the directive of the state governor Yahya Bello for schools to resume on Monday, students, teachers, management bodies in primary, secondary and tertiary institutions appear to have complied. The State Commissioner for Education expressed happiness that the directives given to all schools before resumption to avoid the outbreak of COVID-19 are being adhered to.
Every school, all institutions of learning at all levels in Kogi State must reopen for full academic activities. The Ministry of Education, under my leadership, immediately swung to action and invited all the relevant education stakeholders in Kogi State for a number of meetings where it was agreed on the things that must be put in place before schools could resume. My own team, as I speak with you, are on the field, and we are getting reports from the field on the level of compliance. I'm glad to say that as far as resumption is concerned, there is almost a total compliance, which suggests that people, the students, the learners themselves, are tired of sitting at home.
Let's go over to Bauchi State and get the latest with the efforts to mitigate the impact of COVID-19. Here's our correspondent, Hajara Aliyu.
The Bauchi State Palliative Committee has continued the distribution of COVID palliatives to the most needy communities in Bauchi State. This is Warji local government area. It is the 11th local government area the Palliative Committee has come to for the distribution of food items. These are some of the items here. They are packed in a sack, and the Deputy Governor has just performed the symbolic handover of this palliative materials.
We are bringing 3,500 household palliatives. And like earlier on mentioned by the Master of Ceremony, each bag of palliative contains beans, rice, maize, maggi, sugar, macaroni, all other palm oil and the rest of them. We are distributing this to 3,500 households in Warji local government in the first instance. As we go along and as we get more palliatives from supporters like the COVID who have been in the forefront in sending relief materials to us, and the federal government through the Federal Ministry of Humanitarian Affairs, Disaster Management and Social Development, who have also sent in a lot of palliative materials, we will continue to gauge and continue to distribute these palliative materials to the people of Bauchi State as and when due. So my only work here now is to acknowledge that, yes, 3,500 units of palliative to 3,500 households have been delivered to Warji local government, and I will hand over those palliative materials to the most senior district head for onward distribution to the most needy, because that is the catchphrase, the most needy.
The COVID-19 committee is expected to go around the 20 local government areas for the distribution of these palliative items. From Warji local government area, Hajara Aliyu for COVID-19 updates.
Now, states in Nigeria have been asked to drive the COVID-19 response in their various states and own the fight. But what are the challenges, with the NCDC reporting in August that testing rate declined up to 36% and test positivity ratio declining by about 25%? We have joining us from Abuja studio Professor Maurice Iwu, a professor of pharmacognosy and chairman Imo State Task Force on COVID-19. Thank you for joining us on the program. I'd like to begin with your thoughts on the NCDC's reports that we aren't testing enough, hence we cannot say we are flattening the curve.
I agree with the NCDC. We are not testing enough, but that is really what should happen at this time. We have been on a lockdown with ease of the lockdown. People are kind of getting tired of staying at home, but much more importantly, I think what is paying out that the NCDC own success and the success of the PTF and success of Nigerians in curbing the virus. People are now relaxed, taking it for granted, and that is really sad, because the way what we know about this virus and the story of such viruses is that there is this possibility that you become lax, you think that it is over, when it is really not over. And that's when community-based transmission takes place. And that's when you should actually do more testing and be able to say for sure whether you are flattening the curve. If you have a false positive, as we are having now, we think that we are really doing well when we are not really sure. And that's really very frightening. And that is why NCDC is calling us all to make sure that the states do more testing, and now, so that we will be able to know for sure that the numbers are really down. So I really agree with NCDC that we should test more, so that if they have really done well, we'll be able to know that we have all done well. But what is happening that people are trying to mistake the fact that that they are not hearing the stories of deaths, that shows that nobody is dying. People are really dying out there.
But how best are you managing the response? Because you do manage the response in Imo State with other cabinet members. What are the challenges, especially for testing? How many collection sample sites are there in Imo State?
The private testings can go on without us being in control now that people need the certificates for travel. But for those that are being tested, there is a centralized testing system through the State Ministry of Health. The public health laboratory takes care of all that. So regardless of where the actual testing is being done, there is a centralized collection center for the test, and somebody is in charge, and people will make sure that the samples are also logged into the system so that we know who gets tested and who doesn't get tested. So that's what is happening now. We have the Ministry of Health taking full charge of what is going on. The task force have finished its work in the phase 1. We submitted a comprehensive report to the state government. And then what's happening now that we are more or less doing coordination with the various members of the cabinet, various ministries, the Ministry of Transport, the Ministry of Trade and Industry. They do their part, and because this is a holistic battle. The first phase was us trying to prevent the virus from coming to the state and minimizing the impact. But these second and third phases are totally different. Now that the virus is here with us in the entire country, we have to learn to manage it better. So the only way to do it is to institutionalize the process. And that is why we have asked that the Ministries of Health, the Ministry of Transport, the various agencies of government should take ownership of their role in this fight. And I think they are doing very well so far.
All right, Professor Maurice Iwu, Professor of Pharmacognosy, we'd like to thank you for your thoughts on this issue. Thank you for joining us on the program.
Thank you, Minister.
We have more on the response to the pandemic when we return. Please stay with us. Welcome back. South Africa's tourism sector is eagerly waiting for President Cyril Ramaphosa to address the nation this week and to probably announce further easing of lockdown restrictions to level 1. The sector, which contributes as much as 3% to the nation's GDP, has been hard hit because of COVID-19 shutdown, with losses running into billions of rand. September marks Tourism and Heritage Month in the country, and the tourism sector is hoping government will reopen the international borders.
We probably lost just over or around 120 million rand of revenue a month, an average of that sort of revenue a month. So yeah, it's as you can imagine, as you can imagine, it's been quite stressful for us in this period because you still had to keep the resort running. We do rely on the international market, to put South Africa on the map, to give South Africa the exposure. And the people and the international travelers don't only come to Sun City. They do visit the other major cities in South Africa, and so it has an impact on the tourism industry.
We had to create a plan and look through the cycle, as it were. And the first part of it was about making sure that we protect the supply side of the tourism industry. So basically looking after the hotels, the museums and experiences so that they don't deteriorate or close down. Because what you don't want is after a couple of months to open up, but there's no tourism industry to speak of. So therefore, it was about protecting that. And some injections were made in terms of the UIF TERS, which is supporting, people that are employed salaries. Also included there was the Tourism Relief Fund, which was aimed at really the emerging subsistence, small type of tourism play to hold them together.
Well, let's talk some more about flattening the COVID-19 curve. We have joining us via Skype from Hertfordshire, the United Kingdom, Kudus Majiagbe. He's a microbiologist and life sciences researcher. We'd like to thank you for joining us on the program.
Hello, good evening, Millicent. How are you? And how are things in Lagos and
Very
Nigeria?
well. Very well, thank you. I'd like to first start by asking if you're looking forward to the rule of the six, which a few areas like Scotland have implemented. Do you think it's an initiative that will reduce the number of cases the United Kingdom is witnessing?
Honestly, I can't tell because a lot of variables are factored in. Obviously, if you take the case of Scotland, the rule of six excludes children under the age of 12. Where I am in England, where Hertfordshire falls under, children are counted in that rule of six. And remember that we're into our third week of school starting. So with the bubbles and all of that, as I said, it's just bracing ourselves and we pray that nothing happens. But as I said, everybody has different opinions on it.
So let's talk about let's talk about AstraZeneca trial. We understand it is continuing in the UK, but not immediately for the rest of the world. How best do you think Nigeria can position herself well enough to be one of the countries that will get early access to the vaccine?
Okay, well, firstly, I'm ready to write a check like other countries because I'm sure you see there's what we call vaccine nationalism going on. The only option, as I think when I spoke with Mr. Ladi back in July, is the COVAX, CEPI, Gavi coalition that has been set up at the moment. I don't know if at the moment, because I think about a week or so, they were asking the vice president, he said there wasn't any money for them they could put up front. The only thing at this point, I think we are making some contributions because through sequencing, in Nigeria, with the help of Professor Happy down at Redeemer University, we have 7 strains, and it looks like most of the strains in Africa are of European origin, so maybe that might help us. But at the end of the day, we have to look at it from 2 perspectives. You have the private sector involved in this. AstraZeneca is a private company, and they are not following, unlike with other pharmaceutical companies. I'll use Pfizer. Pfizer has not taken any money from any government. But in the case of AstraZeneca, they've taken commitment financially from the United States and the United Kingdom. So it makes it difficult for Nigeria unless we're able to match what those countries are giving us. I don't know if that has answered your question.
Yes, but finally, you must have heard about the WHO and Africa CDC launching the network of labs. Are you optimistic that this would perhaps aid in the fight against the virus in Africa?
Yes, it's a good development. As I said, if you, when I was explaining, you need the sequencing analysis because you want to know the kind of strains that are in Africa. I think, from what I understand, there are 7 strains in Nigeria, 10 in Kenya, and I think from the variants, you have what is called a SARS-CoV type B1 and B1.1. Those 2 strains, based on the homology, when you look at the nucleotide, because when you do a sequence, you're looking at the nucleotide analysis of the virus itself, there is a match to it originating from Europe. So it, as I said, it puts us at a point. The question is, what are we doing with that data? That is, I guess, the next phase. Because if we're contributing it to be part of the vaccine trial, then it's a good thing. Maybe that might buy us the opportunity to get vaccines in return. But as I said, it's up to the African Union's position, to the African CDC, or individual country. If you take Nigeria, it will be the position of the NDCT championed by Dr. Chikwe, what he wants to do has been our mission control for COVID-19 in Nigeria. NDCT serves as mission control there. So whatever decisions they make, I know the scientific community in Nigeria will be glad to do anything they can to help.
All right. We'd like to thank you, Kudus Majiagbe, microbiologist, life sciences researcher. Thank you for joining us on the program. Now, foreign nationals who have worked on the front line of the coronavirus pandemic in France will be eligible to become citizens more quickly. According to Citizenship Minister Marlene Schiappa, applicants who have actively contributed on the front line of the fight against COVID-19, and in particular health personnel, will be able to see their processing accelerated and facilitated. Here's more on the global update.
Nurses and doctors stand outside Madrid's Gregorio Maranon Hospital holding banners and chanting against the government's lack of support and inability to improve working conditions. In Germany, Health Minister Jens Spahn announces that the country has ordered more vaccine than its population to cover its bases. He adds that the vaccine will hopefully be ready by the beginning of 2021. Still in Europe, British Health Minister Matt Hancock says the United Kingdom is working hard to fix problems with COVID testing.
As we expand capacity further, we're working round the clock to make sure everyone who needs a test can get a test. The vast majority of people who use our testing service get a test that is close to home, and the average distance travelled to a test site is now just 5.8 miles, down from 6.4 miles last week. But the whole House knows that there are operational challenges, and we're working hard to fix them.
In Asia, authorities in Myanmar's Yangon city have begun converting a football field into a makeshift hospital for treating COVID-19 patients as infections across the country surge. 3 township hospitals in Yangon have already been transformed to specifically treat COVID-19 patients since March, and the makeshift hospital was approved for construction after a new spike in infections hit Sitwe and Rakhine states in the northern part of the country.
You can find more updates on our website. That's channelstv.com. At your fingertips, more updates on the pandemic. That's the program this evening. Thank you for watching. I'm Millicent Nwaka. Stay healthy and stay safe.